How has your practice fared since Google started penalizing mobile unfriendly websites in April earlier this year? I'm going to talk more about this when we return. Hi, welcome to the Saturday edition of the Patient Attraction Podcast. I'm Colin Receiver, founder and CEO of SmartBox Web Marketing. And if you remember, back in April, Google started to punish websites that are not mobile friendly by lowering their rankings in the mobile search results. Now, I mentioned it in March as well, and I've talked about it so much that this may seem like one of our Way Back Wednesday, Throwback Thursday, or Flashback Friday episodes, but I assure you it's not. If you're not sure whether your site is mobile friendly, go to Google and Google Mobile Site Check, and you'll find their Webmaster Tools Mobile Friendly Check System. The URL is way too long to try to read out here. Now, I continue to hear from dentists about not understanding why their website wasn't mobile friendly in the first place. And they're also wondering why it's such a big deal. Or maybe they even have a mobile website or have been told their website's mobile friendly, and it's actually not. But let's talk about the former first. According to data from the Pew Research Center, 84% of people who use their smartphone for internet browsing browse every day. This means that they're looking for goods and services, including a dentist, on their smartphone. Now, you might also remember that I told you about 6 weeks ago, Google says mobile searches are now outnumbering searches from a desktop computer. So what's that mean? Well, more people are looking for a dentist from a smartphone than they are from a computer. If your website doesn't load quickly and isn't easy to navigate on a smartphone and have things like click to call and non-touch navigation, you're in big trouble. As for why your website company might have designed you with a mobile incompatible site, there's lots of reasons. Maybe your website's old and it simply predates the need for mobile compatibility. Maybe it's newer, but the web company you worked with wasn't really forward thinking. Maybe it was designed to be a separate mobile website, which isn't the fully responsive gold standard that Google wants today. There's really two types of mobile-friendly websites. First is responsive, and this means your website changes and adapts no matter what kind of device somebody is using. Secondly, it's the lesser standard where you have a separate mobile website. And this means that you have a separate site. It might be m.yourwebsite.com, or it might go to a completely different URL when it tries to detect a mobile visitor that's coming to it. And it can be hard to keep up with that type of mobile website. It's lesser. It's considered lesser right now, first off, because it's not fully responsive. It's designed to be a separate standalone one-size-fits-all. And then secondly, you're looking at what's called a browser agent every time somebody comes to your website and trying to keep up that list. It's not very consistent. Now, fortunately, we've been building mobile responsive websites for several years now, so our clients haven't had to worry about this penalty at all. And this is different from some of our competitors who are now scrambling to update their sites. If you're not sure if your website's mobile responsive and you want an evaluation, click reply on this email. Send me a message, and I'll let you know what I think. We'll also look into evaluating your website with our 131-point dental web marketing checklist. Give you an idea of the deficiencies that are attracting or repelling patients across your entire web presence. Now come back tomorrow. I want to talk about how to elevate the perception of your marketing, of your expertise. Until then, keep moving forward.